Hi, my name's Lia Ali, and I'm a doctor working in the field of mental health. As a psychiatrist, I look after people of all different ages and with all different kinds of health problem. I've seen that people don't really get better unless we can figure out what's important to them and help them to achieve those goals. There is so much to be gained by unlocking the power of the patient in this way. You are the ones that know your own bodies. You know, for example, that when your mood is low, perhaps you can't get your children to school on time, or that you forget to eat. You might not realise that these could be signs of depression, but you know that something is wrong and you know that it matters to you. As a bit of a techno geek, I'm really interested in how we can use digital health tools to help people understand and manage these issues better. Let me give you an example. In our project called Myhealthlocker, we get patients to monitor symptoms and track personally set goals. They can do this online from their own computer or smartphone. They also get some information back from their medical notes. This is from one of our patients in the project, a man who suffers with a condition called bipolar affective disorder. He has always been very mistrustful of health services and has sacked his GP and psychiatrist many times over. However, he does like doing certain things for himself, for example, tracking his symptoms online. What you can see here in the middle of the graph where the lines go down is him getting unwell. However, this time, our patient was able to see how his health changed according to whether or not he was taking the medication that we had prescribed for him. For the first time ever in his life, he took himself back to his GP and asked to go back onto his psychiatric medication. What if this man could have seen his relapse coming weeks ago because his sleep tracker alerted him that things weren't quite right? What if that meant he could get a message to his doctor to change his medication right now, potentially heading off that relapse altogether? We've already seen a revolution in how we bank and shop because of the technology that's available. Something similar is happening in health, but it's much more complicated and the personal stakes are higher. At the end of the day, buying the latest thing from Amazon or doing your online banking is going to have very different meaning to you than trying to manage your diabetes well enough that you save your eyesight or retain your kidney function. And it's because potential gains like this are so huge that even if it is complicated, we really have to try. We might even end up with being able to live healthier lives the way we want to live them.